want to spend some time today talking about endometriosis. So we are hearing about it right now in the news. You hear about it all the time, but right now a lot of people are thinking about it because Lena Dunham from Girls, Friends is my era.
Friends, Girls.
Girls is her era. She's going through it. She's going through something right now. She's been very public about it, so a lot of people are talking about it. What is she going through?
Well, she has endometriosis. I don't know what stage of disease she has because I haven't been involved in her treatment, but so she has been in the news because she actually had to not be at the opening of this next season of the Girls premiere because she was struggling with her symptoms of endometriosis. So what is endometriosis? It's the lining, when you have lining of uterine cells located elsewhere in the body, and commonly it happens on the ovaries, and it manifests itself as ovarian cysts, or what we call chocolate cysts. So these cysts, when you have cysts on your ovary, it can cause problems, pain, they can twist, it can rupture, and she had a ruptured ovarian cyst, which really irritated her pelvis, and she actually had to have surgery to help manage it. So it's not always that way that endometriosis manifests itself. So I said the ovary is a common place for it. It can also be on the lining of the pelvic organs. Also in the space between the vagina and the rectum. So patients have a lot of pain with intercourse, for example. That can also be it. And then the main painful pelvic manifestation is pain with menstrual periods. So that, and it's not just, you know, you talk about a menstrual cramp. It's not that, it's debilitating. So women will talk about feeling there's like glass or having knives in my pelvis every time I get my period. They have to be away from work. It affects their activities of daily living. They can't go to show premieres, they can't go to work. And people think they're being wimps, but it's not. It's a significant problem. Actually, March is Infertility Awareness Month.
Oh, well, that is good.
So it makes sense that we're talking about it.
Because this is the sort of thing that can make childbirth and child reproduction very complicated for you, isn't
so
it?
Pelvic pain is one of the pervasive symptoms of it, but also one of the other manifestations is 25 to 30% of women who struggle with infertility actually have a diagnosis of endometriosis.
That percentage, that's a big percentage.
It's a huge percentage of women. And so women don't always know that this is what they have because it really only starts to manifest itself as you get your first period. But the average age that it manifests is somewhere between 27 to 35 years of age because people have had menstrual periods for a while. And, you know, when you're young, you don't know. You have your first period. It's supposed to be painful. And sometimes you have family members who say, just, you know, here, take some Tylenol or ibuprofen and we'll see how it goes. But when it's very debilitating, it goes to the family doctor and the gynecologist, and there are kind of different levels of disease and different levels of management. So it can go from stage 1 to stage 4, or minimal disease, to moderate to severe disease. So the manifestation of illness depends on how bad it is in the person, and not every woman's experience of endometriosis is the same.
Okay, so you can be anywhere on that spectrum.
That's right.
How do you tell if you have endometriosis? You mentioned there might be pain during your period, but is it hereditary?
It is, actually. So if you have a first-degree female relative that has endometriosis, so an aunt or a mom or your grandmother, it's the next generation, but it's still from your maternal line, then you are more at risk. Also, if you start your menstrual periods earlier, you're more at risk.
Really?
Yeah, because then you've had that. So the theory of it is that some of those endometrial lining cells, the cells that are on the inside of the uterus, migrate out into the pelvis somehow, either, you know, through what we call retrograde menstruation, so out of the tubes and embeds in the pelvis, or is there something embryologically that developed in the wrong spot, so you have endometrial cells there. But so you know when you get your period, your lining grows and then it sheds. If you have implants of endometriosis inside of your pelvis, it will also, under hormonal stimulation every month, when you're shed inside your body, has nowhere to go, it gets trapped. And so how it causes some of the infertility stuff is it causes inflammation and scarring and can scar the tubes. Or it can also cause problems with the abdominal organs that are also in there right next to the uterus and the ovaries, and so patients can have a lot of pain with bowel movements around their periods.
Got it.
Yeah.
Okay, so if you are experiencing anything, any of these things that you might have mentioned, you need to go get checked out.
You do.
Is it easy to detect?
It's a diagnosis that's a diagnosis of exclusion. You actually have to end up with a mini surgery to be able to know that this is the diagnosis. You need the tissue. Because sometimes it's confusing. All of the pelvic organs that are close by, your bowel, your bladder, and your uterus and your ovaries, all live closely together. And so things like irritable bowel syndrome can be mistaken for endometriosis and vice versa. That's why really the only way to know is by doing a mini telescopic surgery through a camera in the umbilicus or the belly button, and onto a television you can actually see the variations of disease. So sometimes people say, I have the worst periods ever, and you talk about it. Let's do what's called a diagnostic laparoscopy. So it's a diagnostic telescope into the belly button, and then you look around and sometimes you see nothing. and they complain about extreme pain. So that's something else is going on.
Right.
But sometimes you see little lesions, so vesicular lesions on where the front of the bladder is, over the uterus or on the ovaries. And then sometimes you actually see those endometriomata, or those are the cysts. Endometriosis is the problem.
Yeah.
Endometriomata are the types of cysts that happen on the ovaries.
Okay.
And the ovaries can be very engulfed in disease. So what you do is you do a surgery, you take down some of the scars, you take out some of the cysts, and people actually right after the surgery, if they want to have a baby, that's the time, because you've had a uterus or a pelvic renovation, essentially. So it's the time to then go and try. And really the management depends on if someone is desirous of pregnancy, or if someone's like, I just want to deal with the pain. Forget pregnancy, I'm not there yet. But a word of caution from the fertility specialist is if you do have a diagnosis of endometriosis, you should be thinking about conceiving sooner than later.
Okay.
Because it does have an impact on your fertility, your future fertility.
But what do they do? So if you decide that you want to have kids one day and you have endometriosis, what are the options that can be done about it?
There's tablets for pain. You can use hormones to suppress it until you're ready to conceive.
Okay.
If you're ready to conceive, you need to go see a fertility specialist. They'll kind of figure out what the degree of disease you have and what it is that you need. You might need to take injectable medications to help you to ovulate more eggs at a time, because there is an impact in the egg quality also with endometriosis.
Oh, good to know. That's really good information.